My name is Shanice Taylor, and I'm going to do a video on the paranasal sinuses. So to begin, we have exactly 4 paranasal sinuses in our bodies, and they're all located on, can you guess, the face, where the nose is, because nasal means nose. I thought that was quite interesting. So the 4 nasal sinuses, paranasal sinuses that we have are the frontal, which are located above the eyes in the frontal region, the ethmoid, which are between the eyes, and they drain into the superior and middle meatus in the nasal region, the sphenoidal sinuses, which lie behind the eyes, and they drain into the sphenoid-ethmoidal recesses. They are superior to the superior concha and the nasal region, so they lie directly behind the eyes. Then we have finally the maxillary, which are located down here in the maxillary region of the body. The biggest or largest sinuses that we have, just as a fun fact, are located in the maxillary regions of the body. Well, the face, not the body. There's a lot of other cavities that are bigger, but moving on. So we have the functions of the paranasal sinuses. Luckily, all the paranasal sinuses are in pairs, which consist of 2 in one set, and they are all together and named after the regions that they are found, so that's a fun fact to be able to know. Their functions include the use of decreasing the relative weight in the front of the skull, and especially the bones of the face. So you'll hear sinus pressure, which relates in sinus headaches, which can happen when you have built up pressure in the nasal region. You have the paranasal sinuses that help increase the resonance of your voice, so that volume control and that weight that you carry when you're speaking, it comes a lot from your sinuses as well. It provides a buffer against facial trauma, so they are a form of defense in a way for our face. Insulating sensitive structures like dental roots and eyes from rapid temperature fluctuations also are in the nasal cavity, happen because of the paranasal sinuses and how they help us. Humidifying and heating of inhaled air because of slow air turnover in the region, so it acts as an insulator and as a filter, our sinuses do, so they're able to help us out, which is why a little bit later in the video I'll go into why allergies happen, or why certain types of issues in the sinuses can affect our bodies and can cause illnesses or issues with us, such as sinusitis or broken bones in the sinus regions that can cause situations to happen. And regulation of intranasal and serum gas pressures are also relative because of the sinuses, and immunological defense. So as I said, the paranasal sinuses are a form of immunological defense. They can help our immune system, and these 4 pairs of sinuses have a rather big job to do in the body. So as we go down, I'm going to go over acute rhinosinusitis, which is one of the issues that you can have in the body, or in the sinuses rather, that can help you or not help you go over illness. So it's defined as a symptomatic inflammation of the nasal cavity and paranasal sinuses lasting less than 4 weeks. So the term rhinosinusitis is preferred to the typical term of sinusitis, since inflammation of the sinuses rarely occur without concurrent inflammation of the nasal mucosa. So up in here, sinusitis, which is inflammation of the sinuses, it rather be rhinosinusitis because of the region that it's happening in. Rhino, nose, hence why rhinos are called what they are because of the large horns in their nasal region. Just a fun fact. But the most common etiology of ARS, which acute rhinosinusitis, is a viral infection, and treatment for the infection focuses on the symptomatic management, as it typically happens to resolve in 7 to 10 days is the lasting effects typically for this bacterial infection. And sinusitis is a self-limited disease. It can also be. Patients can be treated with symptomatically and observed or treated with antibiotics. Antibiotics is a classic form of treatment for sinusitis, and rarely patients with acute bacterial rhinosinusitis develop serious complications. So it is rather common to have, but it can be treated really easy. Another term would be sinus infection, which was why you'll see a lot of inflammation in the nasal region. And oftentimes people can have drainage come out, and there's also a stuffiness in the nose, so congestion is a big one. But it's a big, huge buildup of pressure because, like I said, the sinuses help control that pressure that happens with the paranasal being there as an insulator and pressure wash. Sinusitis can happen because of allergies, air pollution, infection, or structural problems in the nose, which is going to occur with one of our case studies that I'm going to say in a minute. Referring to the structural problems in the nose. Most cases, though, however, are caused by viral infection and can be present if symptoms last 10 days if a person worsens after starting to improve. So things can turn further worse and look like they're getting better with sinusitis. X-rays are not typically needed unless the complications are suspected, but you would go to a specialist, which would happen to be an ear, nose, throat doctor, which is an otolaryngologist. One of my favorite words actually in school. So, the pathology of rhinosinusitis or sinusitis is related to 3 factors: obstruction of sinus drainage pathways, ciliary impairment, and altered mucus quantity and quality. So any of those 3 cases I just mentioned can make sinusitis a big deal to happen. Like I said, drainage is a big deal with sinus infections in the skull. Mucus flow is regulated from the paranasal sinuses. They do a lot with the pressure, like I said. I'm not going to repeat that too much, but that's a big point of emphasis to understand. One of the case studies that I'm going to be using is what was given to us in the class. So Daniel gets into a fight at a sports event and receives a broken nose. There's that structural problem again. He's taken to the hospital and x-rays were performed. About 10 days later, after his nose heals, he starts to have sinus pain and discomfort in the area around his maxillae. So here's the diagram again. Maxillae region would be found right up in here. So that's the region Daniel's having trouble. He has a broken nose. He's taken to the hospital. X-rays were performed. About 10 days later, his nose heals. He starts to have sinus pain and discomfort in the region around the maxillae. So what is probably the cause of Daniel's discomfort? So Daniel gets into a fight, number 1, and fractures his maxillary bone and sinuses. X-rays are performed and his nose starts to heal. As the nose heals, the inflammation from the injury in the bone rebuilding begins to block the maxillary ostium, connecting the maxillary sinuses, which are here, to the middle meatus where it's supposed to drain. So that drainage is being blocked. The maxillary cannot drain now and drains poorly, and fluids, the mucus, begins to build up in the maxillary sinus and produce pressure. So there's that pressure buildup that's happening from his sinuses. His nose has a structural impairment in it. So Daniel's going to need surgery to be able to open up that maxillary ostium and drain properly in the maxillary sinuses before infection begins and infections nearby the organs, because the sinuses have that buildup. So you have pus and you have bacterial infections, other kinds that can get into the different organs. You have the eyes that are next to the maxillary region. You have the orbital cellulitis that can happen due to buildup of pressure and bacteria. You also can have different infections through your glands. You have your adenoid glands. You have different glands that can receive that bacterial buildup that can happen. So you want to make sure that if you have sinusitis, or dealing, as we're hypothetically having Daniel's situation, that surgery is able to drain and cause that drainage to come out properly before he deals with other complications. So that was one of the things I wanted to say. So it all fits into, in closing, it all fits into the paranasal sinuses having to deal with not only the pressure, insulation, and regulation for mucus, pressure buildup, and for quality of air flow by making sure we keep, allergens or any type of pollen or anything that can corrupt our airflow out. It cleanses. But the paranasal sinuses also have a structural component that if your nose is broke, or if there's a region around them that is impaired structurally, you will have some type of damage. So you always want to make sure that these 4 regions are taken care of properly. So again, the 4 regions are the frontal, you have the ethmoid, then you have the cephnoid, then you have the maxillary region, and there's a close-up of it so you could see. And I hope that you enjoyed the video and that you learned something, and have a great day.